Part B candidates, welcome to this anatomy station for the MRCS Part B. And this station is going to be about the urinary bladder. So the first question is going to be identify the urinary bladder, and this is the urinary bladder with the number 2 here. Okay, they are going to ask you also to identify the internal iliac vessels, and this is the common iliac artery here. Okay, number 3, and here is the external one, number 7, and here number 25 is the internal iliac artery. So they are going to ask you about this internal iliac artery, either here and here you want to know. Okay, so after identification, so first question is about identification. You finished it already. Okay, and the second question is going to be about the posterior relation or related structures to the bladder. Okay, so this is the urinary bladder, and in this case here for this question you are going to divide it into 2 parts. The first part is for the male and the second part is going to be for the female. Okay, so in the male, you know that posterior to the bladder is the rectum directly. So number 1, between them there is a pouch. It's the number 1, the recto-vesical pouch. Okay, this is number 1. Number 2, in the male you are going to find the 2 vas, right? 2 vas difference, and also you are going to find the terminal parts of the 2 ureters, right? This is in the male. In the female, you are going to find only 2 structures, as behind the urinary bladder you are going to find the uterus, and in between them you are going to find what is called the vesico-uterine, between the bladder and the uterus pouch. And you are going to be, because the lady has no vas but she has ureters, so number 2, you are going to find the terminal parts of the 2 ureters. So this is the point here. These are the posterior structures to the bladder anatomically. Okay, well, the third question here is going to be about the blood supply of the bladder, and as you know, the bladder is supplied by 2 structures. The first structure is the superior vesical artery, and the second structure is going to be the inferior vesical artery. And to make your answer complete, you want to mention that those are coming from the internal iliac artery. Okay, so this is a full answer. You want to add this part so that you can get the full mark of this question. The fourth question is going to be about the venous drainage, as usual. Okay, and in this case here you are going to mention that the urinary bladder is going to drain to the it's called the venous vesical plexus of veins. Okay, this is a good answer, it's a right answer, but to make your answer complete and get the full mark, you want to mention that this venous vesical plexus is going to drain directly to the internal iliac veins. Okay, so in this way you are going to get a full mark in this question also. Well, the fifth question is going to take you to the nerve supply, and here in this case they may ask you what is the muscle of the bladder, and you may mention it by yourself. They do not focus on this, but as you know, it is the detrusor, right? So regarding the nerve supply of the detrusor muscle, what do you know about it? You are going to mention that there are two types of nerve supply. The first one is sympathetic and the second one is parasympathetic, right? Parasympathetic. So the sympathetic one comes from L1 and L2. You have to mention that. The parasympathetic comes from S1, S2, S2, S3 and S4, or you can mention from S2 to S4 as you wish. There is no problem with that. But there is another piece of information that you want to add, and this piece of information is the sympathetic one actually relaxes the trousers muscle and the bladder, and the parasympathetic contracts, increase the contraction or contracts the trousers muscle. Okay, so if you mention this in this way, sympathetic, parasympathetic, the first part, where are they coming from, as mentioned here, and the action for every one of them, these are three parts, you are going to get the mark that you want. So now they are going to ask you some controversial question about the relationship of the urinary bladder to the peritoneum. Okay, so is it intraperitoneum or is it extraperitoneal structure? So you want to mention that it is partially intraperitoneal because it is covered only, okay, covered at the following sites. Number one, the superior surface of the urinary bladder is covered by the peritoneum, and the upper part of the posterior surface is covered by peritoneum. The remaining parts or the remainder of the urinary bladder is not covered by peritoneum. It is completely extraperitoneal. Okay, so you want to remember this because it's a little bit tricky. You are going to be asked another question, maybe this is the seventh one, that how does the ureters enter the bladder, and you are going to mention it in two pieces of information. So number one, I'm going to make this for you just to remember during the examination time. Okay, so number one, okay, it's going to enter, the two ureters are going to enter at the base of the bladder. Okay, at the base of the bladder. Number two, it's going to get in at the corners of the what's called the trigon. Okay, triangular structure that you see from inside the bladder. It's mainly at the base. So these two parts you want to mention. Firstly, which is easy, it enters the bladder. How does the ureters enter? The ureters enter to the bladder. They enter at the base of the bladder, and they enter at the corners of the trigon. Okay, so now this is easy. Okay. Question 8 actually is a clinical or a therapeutic question, and here in this question they are going to ask you about the layers that are encountered during the suprapubic catheterization. Okay, and just to make a long story short, there are 6, okay, and we are going to mention them all here. Number 1, number 2, number 3, number 4, 5, and 6. So the first structure, it is, yes, exactly, it is skin. Number 2, as usual, it is the subcutaneous tissue. Okay, here in this case, number 3 is what is called the scarpus fascia. Okay, and number 4 is going to be the linea alba. Okay, number 5 is going to be the fascia transversalis, well, and finally the retroperitoneal fats. Okay, so these are the 6 layers that are going to pass through when you enter a catheter above the pubis or suprapubic fluid. Okay, the skin, subcutaneous tissue, scarpus fascia, linea alba, fascia transversalis, and retroperitoneal fat. So since this point, moving forward, all the questions are going to be about the cancer. Okay, they are going to be about cancer. All the questions, or actually all the questions of this station are 11 almost, and the remaining 4 are going to be related to the, or the remaining 3, sorry, are going to be related to the urinary cancer. So what are, first question, what are the common types of urinary or urinary bladder cancer? We are going to mention transitional cell carcinoma, number 1. The second type, as you remember, it was the squamous cell carcinoma. The third type for the perfect answer is mixed, and the fourth type is called the adenocarcinoma. Okay, carcinoma. Anyway, carcinoma. Well, so transitional cell carcinoma, squamous cell carcinoma, mixed, and adenocarcinoma. These are the types. This is question 9. Let's go to the next question. Well, the next question is going to be about the clinical picture. Okay, the clinical picture. I'm going to change this color. It's going to be what is the, in other words, what will be the main complaint of the patient who is having urinary bladder? And in simple words, as you know all, it's pain, less hematuria. Okay, painless hematuria. This is the right answer, only 2 words. Okay, let us go to the last question in this station, and the last question is about it's question 11, I think, and it's about the risk factors. What are the risk factors related to the urinary bladder cancer? Okay, and the risk factors actually are 4 here that you want to mention. Number 1, you want to mention what's called the aniline dyes. Okay, as I remember, it's aniline dyes. Let's see, aniline dyes, and I think like this, aniline dyes. This is the first risk factor. The second one is the smoking. The third risk factor is the naphthalamine. Okay, naphthalamine. Okay, or naphthalamine if you want. And the fourth one, which is known to all of you, is the organism Schistosoma hematobium, or MRCS of the bladder hematobium. Okay. So these are the risk factors for the urinary bladder cancer, and by this answer we have answered all the questions of this station, and I hope you have good luck with it.